top 10 for the high suicide rate in the world.
We have implemented a decriminalization of suicide. A lot of countries that were once British colonies still maintain these laws.
I decide to commit suicide. I take the poison bottle and drink it.
There shouldn't be any stigma because mental health issues is just like any other issue that you might have, any other problem. It's like diabetes, it's like high blood pressure.
If positive change is needed, political will is necessary.
All right? How are you doing?
Our mental health laws were quite outdated. In fact, going back to 1934, colonial laws were not fit for purpose. The terms that were used were very obsolete. Terms in the law that speaks to people being an idiot, terms that would be derogatory in a modern society. The principles that were encapsulated in that law is not fit for modern healthcare.
I want to commend all my colleagues for speaking on this matter. This is something that we have been talking about for many years now. And finally, we were able to bring it to this assembly and to pass it. Thank you very much.
2022, two landmark legislations were launched, the Suicide Prevention Act and the Mental Health Protection and Promotion Act, a different law that deals with working or having mental health services and treatment in a more human rights-based approach. For many years, there was only two places Guyanese could have gotten those services. The Georgetown Public Hospital Psychiatry Department was one, where persons who need an acute care would go there. If long-term care was needed, persons would be sent to the New Amsterdam Psychiatric Hospital, which, for all intents and purposes, was Guyana's asylum.
If somebody was deemed to be insane, you lock them away and that's it. It was felt that they were a menace to society.
This stigma is very much alive in the community. People don't want to come to the hospital, even though they know they need the help.
Helping to break that stigma in order for persons to get help. Because of trust issues and past experiences, a lot of persons don't want to open up. They will just simply say, by the time I get home or by the time I leave somebody's house, my entire family knows, the entire street knows. So helping to break that barrier when it comes to the stigma, that would be a stepping stone for us. When they're not feeling that well mentally or they speak about it, they're perceived to be mad or they're perceived to have evil spirit on them, that spiritually something is wrong with them.
There is a very big stigma, and this is one of the reasons why we want to go away from having a mental health facility or a psychiatric hospital. For people to access mental health care, they have to come to the psychiatric hospital. We tend to patients from all 10 administrative regions of Guyana, from Essequibo to Linden to Georgetown.
Modern thinking, however, is that persons should not be institutionalized. When a person has an acute episode, they would come to the hospital, they would be treated, hospitalized like with any other condition, and then you're discharged and you have follow-up care at a different level. Right now, we are in a phase of developing new infrastructure. We have under construction 8 new hospitals. We also would start another set of hospitals in another month or so. This would include Maruka, Keto, Camarang, and Letem. These new hospitals provide specialized care, which for a long time only happened on the coast of Guyana.
You have a mental health issue, you get help in the very same regional hospital. I was sent here by the Ministry of Health We are moving our mental health service from a central level to the communities. 2 years ago, when I started working here, I met a total of 215 patients. With the help of the ministry and the Georgetown Hospital Psychiatry Department, we worked to decrease that number of patients. We make sure that we get to the bottom of what their diagnosis is. We found their family history.
Why are they here and those kind of things.
This patient, Madasi, he has been here for quite a number of years. He is very stable, right? He had his diagnosis. What we're trying to do is to get contact with other family members so he can go back into society, move back into his hometown and live. He helped the patients out, right? He's a nice guy. We chose the persons who we found that had a social support, that can get access to mental health services wherever they're going. We made contact with the family, we made contact with the community, we made contact with the hospital where they're going, and we try to reintegrate that person back into the society. We're going to see the patients who are here for like many years. They're ready to go home, but because we don't have any family member for them, they're living here. What we should have is mental health services being offered in all 10 regions of Guyana so that people can access quality mental health care without having to be institutionalized. This is the acute ward. The patients that would just come in for like drug abuse and domestic violence, court would send them to the hospital. Prior to the new mental health legislation, we had a problem where the court would send patients and we'd have to keep them here for probably 6 months to 8 months, sometimes a year. But with the new legislation, we don't have that problem. What we want is for people to be in the community, access quality mental health care, and at the same time, live with their family in a dignified manner, just like everyone else, and not being sent away to, in the layman term, a madhouse because you have a mental health problem.
We're very grateful for having laws that are user-friendly, laws that speak to the benefits of patients. Patients now have rights. Our prior mental health ordinance dates back to 1930. Suicide attempt, they were considered criminal.
A lot of countries that were once British colonies that still maintain these laws. If somebody attempted suicide, you're not going to get people reporting it. And if you don't report, then you can't solve the underlying problem. So they don't need to be in jail. They need help.
A national suicide prevention helpline is going to be launched before the end of the year. It's going to be 24 hours helpline, which we will provide with counseling services. Now, this is something that has never been done in this country before.
Hi, good afternoon. IDRF Guyana. How may I help you?
Something that is going to revolutionize the way things are done dealing with suicide attempts.
I work in a new department established at the Office of the President. It's called the President's Special Initiatives for Health, and we work primarily right now on mental health projects. Our project office is spearheading a national mental health website where anyone can just log on to the website, access information, general mental health awareness.
Since the implementation of this law, that there has been a significant drop in the cases of suicide. We have almost halved it.
There will be a 24-hour chat service where anyone can log on to this website and talk to someone if they're experiencing crisis, if they just feel down or depressed and they just want someone to talk to. We're hoping to have that launched in tandem with World Suicide Prevention Day. If someone is in need of further counseling or they need to schedule an appointment with a professional, all of that can actually be done through the chat response agent on the website.
Me and my husband got a little problem, and then my sister-in-law, she came in and she started to beat me up. She take my phone. She said that unfair with a man. Then I go back my mother them and With the drinking speed, I go and I take the poison and I drink it.
70% or more of the suicides that occur are done by pesticide ingestion. They primarily occur in East Indian communities. It could be because these are the persons that actually have easy access to the pesticides, the people who live in farming communities.
I was in the hospital for 2-3 days. The police came and they take statements, and when I got discharged, I go back by my mother them. And my husband come and he asked me pardon, and after that, we live back happily. I have 2 kids and they're small, and I will never do it again. I would like to have a counselor with me and my husband.
In Guyana, we're dealing with a mental health project. That project is currently now being executed. The project is tailored in such a way to tackle suicides.
Me and my husband does not really get a problem. One day I decide to commit suicide, where I take the poison back and drink it. And then I land in the hospital. When I came out, come and give me advice not to drink poison, stay away from suicide. I'm feeling quite all right since I seek advice from people.
We had national suicide prevention training, which would have trained a total of 760 persons.
I urge young people like me who have problem at home to stay away from suicide.
What we have been doing is taking mental health care delivery to the communities. We have been creating beds in general hospitals to treat people with mental health needs. And so they don't have to be transferred from their communities to a central location in Georgetown or New Amsterdam. So tremendous changes. We have clinics in all the regions of Guyana, except Region 8, but we practice telemedicine. All the regions, they have access to our on-call roster, meaning a team being available to people with mental health needs across Guyana on a daily basis. Many times, a team of persons will bring in somebody who is physically restrained because that person was creating havoc in the village.
I am Mr. Sean Spencer. I work here at the Johnson Hospital at the psychiatry department. What basically we do here, make sure there are no sharp objects or tools or knife, whatever, anything that it can harm the cell.
They can be very threatening to all those who are around them.
Working along with the doctors and the nurses, helping them also to apply the medicine and the injection, whatever they needed assistance.
They can get really ugly, but that's not what we meet every day. We have outpatient clinics, and our doctors go there once or twice or more than twice a month. On the East Bank, we have been able to put a psychiatrist who takes care of that corridor. In the Department of Psychiatry, we see an average of about 500 persons per week as outpatients, and as inpatients, we will have on a daily basis between 8 and 18 inpatients. It's just like any other part of the world where you have anxiety, depression, substance use, chronic diseases, the psychotic type like schizophrenia.
In this very compound is where the new Berbice Hospital is going to be built. The plan is to have a wing for psychiatry and mental health into that hospital. In that service, we would offer all the service being offered here, but in a general hospital setting.